Hi everyone. I'm Jessica Reichert. I'm a senior research scientist. I'm actually a criminologist, but I've done a lot of work in the, criminal justice and behavioral health research field. Um, my agency is a state government agency, and we administer federal and state grants for criminal justice victim services and violence prevention. And then we also have a research unit, and I'm in the research unit. If you want to check out our website, we have a lot of publications. Not all of them having to do with behavioral health, but many of them do. And it's just the funding acknowledgement. And so what I'm going to cover is explaining what is police-led deflection, and then covering how effective it is, and then sharing some outcomes from a national study I was involved with that looked at multi-sites of deflection programs in the country. So if you hadn't heard of deflection, what is deflection? It is basically where police or other first responders offer a warm handoff to treatment or other services. It's typically for people with substance use disorder, but there's a couple programs I'm evaluating now that one deals with homeless people and the other one is for crime victims. So there's been some expansion, but above, it's almost always substance use disorder or mental health. So for law enforcement, these deflection programs, and we say deflection instead of pre-arrest diversion because deflection is there was going to be no arrest. So deflection programs can help individuals receive referral to services without any fear of arrest. And it's voluntary. So these are cases when law enforcement has the discretion, wasn't going to arrest them, but sees their need for treatment or services. So it provides another alternative to police rather than either making arrests or doing nothing. So they encounter people with substance use disorder or other concerns, often in their work. So the factors, like substance use disorder and mental health can certainly be factors underlying the contact with law enforcement. So deflection can possibly help people get services and hopefully not enter the system, because we know entering the system for treatment isn't the best way to go about it. But potentially people could get treatment before having to get it while incarcerated or part of probation or something like that. So there are different pathways, as they call them. It's really just different ways that police can find people that need to be in a deflection program to get treatment and services. So there's a number of programs that are self-referral. So that means people just voluntarily walk into a police department, police station, and say, I need treatment. And for some people who hadn't heard of this before, it may sound like people would never do that, but I evaluated a program called Safe Passage in Illinois, and it was very effective. There weren't a lot of treatment programs locally. There was no residential treatment in this resident or rural area, so they would have people would come to the police department, and then these volunteers would drive them to treatment, sometimes hours away, to help them. And some of the programs are called like Angel, A Way Out, Safe Stations, or as I mentioned, Safe Passage. They all have different names. Then there's like active outreach, so officers seeking out individuals. There's some different names like Hot Homeless Outreach Team, where they're doing outreach. I'm evaluating one right now that is for homeless. So they in Springfield, Illinois, they go out and offer assistance to people on the street. It's part of a co-response with social workers. And then there's post-overdose. I know these are very popular in Ohio, and they're called quick response teams. They just sort of really expanded there, but they're all over the country. So people have a non-fatal overdose, and police, along with a team of other people, stop by their home, offer treatment because they know they'd be at risk for overdose again. And then there's officer prevention. I don't know if anyone's heard of LEAD, but LEAD has been around for over a decade. It started in Seattle, called Law Enforcement Assisted Diversion. And they're officers out there on patrol, sometimes with community members, but seeing people in need and offering them treatment. And then finally, officer intervention. Some people have heard of co-responder, as I mentioned before, where police are with others. And sometimes there could be an arrest, but they're saying, I'm not going to arrest you, but I want you to participate in this. So it's usually voluntary, but that could be a little bit of sort of, I don't know, I should say coercion or a way to get people to maybe think about getting treatment when they otherwise wouldn't. And I'll say that these, it's a new field of deflection, but they've really grown. There's thousands across the country. Some of them have been state or federally funded. I know Oregon right now there's like a state mandate, really all the counties to start doing deflection. So it is, increasing in number of these programs across the country. And I made this little cartoon because I guess for those visual learners, as we heard earlier, this might be helpful to kind of see the difference between deflection and diversion as it's kind of been defined now. So deflection is someone, a police officer typically, seeing someone who needs help. And instead of getting them involved in the justice system, saying, we can help you and you don't, let's bypass going into the justice system. And then diversion is more like when you've at least had an arrest, so you have that record, and then you're in the system, and then they are mandated to services. So at this point, you're involved with the justice system, and now we're making you go. So that's sort of the difference. Okay, so I'm going to provide some summary of some research that has been done. There still isn't a ton of research, but there's more and more as the time goes on. I wrote this journal article. There was a journal dedicated to deflection. It's called the Journal for Advancing Justice, and they had an issue on deflection, and I helped write the introduction. So it's a good way to kind of learn a bit more about deflection, sort of a summary. So kind of goes over the history of deflection, some challenges, the current research, and some future research needs. So just wanted to point that out. And then there was a national survey of police deflection that was done. Forget what year, 2021. See, it's on the slide. So the University of Chicago, NORC, was it National Opinion Research Center and Task, conducted this. They found most programs started in 2018. 1 out of 6 conducted formal evaluations to assess impact. That survey came up with 329 programs in 39 states that responded to the survey, but we know there's a lot more than that. So some common features are there's law enforcement led, there's collaboration with service providers, there's a dedicated program coordinator, they offer substance use disorder treatment mostly, and medication-assisted treatment and recovery support. And then there was a brief summary of deflection and pre-arrest diversion research by some researchers at the University of Cincinnati. And they found 31 studies, and that includes deflection and pre-arrest diversion, not just deflection, but there are 31 studies, 24 in the US. They looked at both quantitative and qualitative analysis. 16 outcome evaluations with the comparison group. Most studies found that deflection reduced recidivism, and 45% of the programs reduced substance use. And that was published in 2021. And then there was a systematic review of deflection and pre-arrest diversion by some researchers in Canada. They found 37 studies. They found that these programs reduced criminal offending. They found it was promising for improving health, reducing social and public safety costs. And they also looked at the qualitative studies and found that there was officer support for the programs, that they collaborated together, there was clear eligibility criteria, and timely access to services. So recently there's this state leaders in deflection group, and we're writing a sort of a brief where we're looking at the research again. It wasn't really done in a systematic way, but it is more recent that we just did it in the past couple weeks. But we found the studies increase public safety by reducing recidivism, improve public health by increasing treatment engagement, reducing substance use, reducing overdose, improving quality of life, offered a cost benefit, reducing criminal justice and healthcare costs, and also reducing stigma. So those are all very promising. And then I'm going to talk now about a multi-site evaluation I worked on. So it was, so the National Institute of Justice, through the Department of Justice, put out a solicitation for research grants specifically on deflection. RAND was awarded the grant, and it was in collaboration with me and my agency and TASC. It was a 3-year study that started in 2020, and we had 2 phases. One was to do case studies in 6 states, and then trying to do an outcome evaluation in a couple sites, and we were successful in one of the sites, which is Illinois. So the case studies, again, we looked at 6 programs in 6 states. They're in various stages of implementation, and there was a total of 39 virtual stakeholder interviews conducted. And here's the sites we looked at. I highlighted Illinois because that's the one where we got the outcome evaluations that I was kind of the point person on. And then we looked at Washington, Wisconsin, Massachusetts, Pennsylvania, and Indiana. And I won't read this, but there had some similarities, but some of them had multiple agencies, some had just one, some had the different deflection pathways. So from those case study interviews, we found most of the program started because of the overdose crisis. Other reasons, we heard a lot, you cannot rush your way out of this crisis, that it could reduce, deflection could reduce burdens on law enforcement and other first responders. Police had fatigue from, going on overdose calls, sometimes repeatedly having to deal with the same individuals and wanting to see they could do something different that could be helpful. And for some, they wanted to do something about some community complaints. And then we asked about perceived benefits. Deflection can provide new ways to engage with people with substance use disorder, facilitate connections to services, improve a public health with public safety relationship, and reduce stigmatizing attitudes. And then the programs that we talked to, there was some agreement that there was stories about successful clients in recovery that never had any involvement with the legal system. There's also people who had gone through the program more than once. Some keys to success according to the programs. Having an organizational commitment in the police departments, having champions, and that's been echoed in other studies where a champion is usually a chief of police, kind of leading everybody that this is a new way of doing business and should be supported and can be effective. It's also really important to have collaboration. It's not just police alone. The police are just doing the warm handoff and then they're kind of out of it. And that's kind of something, the place they want to be, because that isn't, they have to respond to a lot of calls, but they aren't necessarily the experts or the ones who are best equipped to handle it. So really working with the behavioral health providers in the community is important, that they can make sure they're handed off and get the support they need. Dedicated funding streams in the states that were Medicaid expansion states, that was helpful because people could get more coverage. And they learned from other programs, and there's also just a word of mouth among police departments and programs that, you know, there was a good track record and it was working, and then it kind of grows from there. And then some barriers. Stigma still continues to be a barrier. Not all police are going to be supportive of this, and some people won't. Some police won't think it's their jobs or something they should be doing, of course. There can be difficulty in information sharing. I'm an evaluator, so sometimes getting the data to see how people are doing down the road, especially if they're in treatment, can be challenging. Got to make sure that you have all the forms and signatures in place to be able to track people. And police may want to know how people are doing, and then there might be some barriers to being able to provide that information to them. And there's always going to be service capacity, particularly housing. People need things that there just isn't enough to go around. And then also just funding or inability to pay for services. And then in terms of funding, some programs started like the self-referral just with really no money, where, you know, police are passive, waiting for people to come in and say they want help. And then maybe some of them had agreements with the local public health department, and then just sort of handed people off. So it can be low cost. And then some programs have gotten federal or state grant funding, or even, you know, local city funds dedicated to such programs to pay for officer time, maybe it's overtime, pay for some training of officers, if there's client transportation that needs to happen. So those kind of things could be helpful. Maybe more naloxone or things like that are needed. So now I'm just going to go to the outcomes part. So we looked at the program called The Way Out in Lake County, Illinois, which is just north of Cook County where Chicago is. So it's sort of, part of it's like the suburbs, and kind of bordering Wisconsin as well. So we found some great outcomes, that there was reduced fatal overdoses, reduced non-fatal overdoses, reduced fatal opioid overdoses, and reduced property arrests. And we looked at data from 2016 to 2020. We used a synthetic control model where we compared Lake County, which had a program, to similar counties in Illinois. And the RAND folks, statisticians, did the analysis. So those were some great findings. I was also just going to mention, I did a little study where I looked at police deflection policies. That was published in a journal about, we looked at 16 police department deflection policies, or sometimes they're called police orders or directives. It's what the police officers are supposed to follow. And we found there was some stigmatizing language sometimes, using abuse or addict, which is concerning. None of the policies mentioned harm reduction or mentioned training. And then there was some restrictions to participation that maybe could be removed. Some had said no minors without parental consent. Some said they couldn't have outstanding warrants, where some programs kind of work with the prosecutor. Oh gosh, I don't know if you heard that one, Kat. But I'm almost at the end. So there's I'll just move on. So here's just my citations. These are from all the outcome studies